as your host for this session of iTalks webinar. I welcome you all for the 119th session of this iTalks webinar powered by Mero Eye Academy. Without any delay, now I would like to have the opportunity to interpret this.
Let's close the door.
So prior to the beginning of our talk today, I request you all to do the attendance from the link that is dropped on our chat box, for which you will be receiving a certificate at the end of the webinar. And if you have any queries in between the session, I just request you to drop your queries on our chat box, which we will discuss it later on our discussion session. So for now, let me introduce our today's presenter. Today we have our guest, Dr. Ajeet Bhardwaj, who is an M.Optom founder and director of Optique in Vasant, Bihar, New Delhi, and we will be talking on topic latest technology in Tele Ophthalmology and Tele Optometry worldwide. So, Dr. Ajeet, I welcome you on the behalf of Mero Eye Foundation and all our participants. Over to you, Doctor.
Hi, good evening. Thank you. It's my pleasure to come back to all my optometrists in Nepal and all of you on this platform. This is my second presentation, and I believe I made a presentation last year on the same topic. And that presentation covered a little bit of history of telemedicine, the steps we can use to implement telemedicine in your practice, what are the ethics we need to follow when we see a patient in our telemedicine practices, what are the various modes of consultations, synchronous and asynchronous. I explained all that in detail, and I'm told about the telemedicine laws, what we have in India, which were introduced on 20th of March 2020 last year. And I demonstrated what are the various optical, optometry, and ophthalmology procedures we can do using telehealth platforms. And today I'll be moving to the next step. I presume and I believe that all of you have shared, have you seen that video which I have already, which is available on YouTube, and I shared with Kapil, and I feel it will really be helpful to understand this if you have already seen my previous video for better understanding of teleoptometry and teleophthalmology. See what has changed in the last 1 year. This is what I'll be looking at. I'll be sharing with you. Last year has been a bit of challenging for us in a sense that because of pandemic, most of our health workers, most of our people at emergency, care workers, people in the front offices, they were having a tough task having to deal with all the patients affected with COVID-19. And this has changed the whole ecosystem of healthcare delivery in India and I believe worldwide. And there has been, technologies have been changing in healthcare since we have come into the profession and since time immemorial. But the way we have adopted technologies and the new innovation in last 1 year in every field is something which has, which I have not witnessed, and I'm sure no one of any of you have not witnessed. Everything has changed. The way we communicate, the way we give lectures, the way we interact with people, the way we conduct our functions, ceremonies, our birthdays, the way we conduct yoga classes, the way we do celebrations, and the way we do obituaries. So every aspect of our way of working has changed, and this has impacted the ecosystem on healthcare as well. This adoption in healthcare has been challenging in the sense that we felt that patients will not be appreciating, because we have been providing, all the doctors have been providing teleconsultations on email, on WhatsApp since long time. But now the whole thrust, the whole impact because of safety reasons, because telemedicine is one of the safest way of meeting our patient digitally, keeping our patients safe and healthy, not only our patient, but our doctors too, because if you have heard the news in India, we just read last week that about 1,100 doctors of different specialty in India have died because of COVID infection. And there were figures that 20 doctors were dying because of COVID. And this is a great concern for all of us. And we being in ophthalmology and optometry practices, we are very close to our patients because we have our procedures are very, we have to go direct ophthalmoscopy. We have to go really close to the patients for our examination. And secondly, our number of consultations in ophthalmology and optometry are much, I'm talking of volume, they are much higher than other fields of medicine. So we are very prone to this problem. And fortunately, that ophthalmology was quick to adopt telemedicine for the reason that after radiology, dermatology, and pathology, we are the health sciences faculty which rely more on images, in the sense that we could take pictures and those pictures can be interpreted. And this adoption of images moved us to adopt telehealth faster than other healthcare professions. And this has changed the way we examine our patients, and not only in India, but worldwide. And this has some of the technological changes which have happened in last 1 year or last 2 years. The number of telemedicine consultation have risen very sharply. The number of telemedicine platforms that have emerged, companies like I'm sure Practo is in Nepal too. They are in 20 countries. We have 22 lakhs doctors registered on Practo, providing almost lots and lots of consultations every day. And there are platforms like LiveDate, which has 80,000 doctors with them. So the number of telemedicine consultations have grown up to the extent that so many other health platforms, so many applications like MFine. This is a telemedicine company that only works with eye hospitals in India, and they have 500 eye hospitals, not eye hospital, but all specialty hospitals. And they have 500 hospitals providing MFine telemedicine platform to their patient. There are many applications like Health Journey, Dhani app, and Health Buddy. There's lots and lots of patients are being seen remotely by doctors of all specialties. And another factor, if you look at what has changed in the focus of the industry, focus of IT companies, like if you look at companies like Apple, Microsoft, Google, and IBM, their focus have changed or maybe now shifted, that they want to be called a healthcare company no more. They want to be recognized as an IT company. And they have a vision and they have aim that they want to be number one in telehealth or number one in healthcare. And if you look at the largest telehealth provider in the world is Google, because most of our patients, they come and take their consultations from Google first before they come and see us. And that is changing dramatically. If you look at retailers, online and offline, companies like Amazon, which is the largest online retailer, they have started a platform called Amazon Care in US, whereby all their employees in 50 states of US can get teleconsultation without stepping out of their offices. And companies like Walmart, which is the largest offline retailer, largest retailer in US, they have started their Walmart Health, and they've started 19 health centers across US and providing online and offline consultations. And I'm sure that the company in Tata in India, they're very big in every field, known for starting from Tata Steel. They have ventured into a health platform which is called telehealth, whereby patients can get consultations from as low as 100 rupees onward to meet their primary health physicians. So the dynamics of this is changing from across the industry, everyone, and every healthcare provider now is looking to be involved, and they need to be involved because of the various changes, various equations which has changed in our health system. On not only the safety, but accessibility, or able to not able to reach to the remotest locations, with use of telehealth, we can reach patients in any corner of the world, whether it is India or Nepal. You can be sitting in any locations and be able to see your patients sitting in any part of Nepal. And accessibility at a very cost-effective manner, keeping the safety of you and your patients is the priority, with convenience to the patient. And I'll be talking to you some of the platforms which I want to mention. I had already defined what they are. There are two types of consultations in healthcare. One is asynchronous and other is synchronous. Asynchronous kind of consultation is that when your symptoms, your history, your all clinical signs, your all details are stored and forwarded to the doctor. It means you don't see your doctors in live or in with audio or in video mode. So patients don't have direct interactions with your provider, and this mode of communication is asynchronous. While in synchronous mode of consultations, you and your consultant, like patient and the doctor, see each other either by, not either, but by both audio and video mode. So synchronous mode of consultations require personal attention of the doctor immediately when the patient is there on your platform. And these are the two ways of communicating to or consulting your patients. And this can be a hybrid model also. And hybrid means that part of the consultation can be asynchronous and part of the consultation can be synchronous. And why they are defined separately is because there are different reimbursement and there are different charges paid by insurance companies. And asynchronous attract lesser fees, while the synchronous mode of communication, mode of consultation requires a higher reimbursement from the medical insurance companies. Well, what is happening in India, and I believe it's the same thing is happening in Nepal, most of our previous telemedicine providers, most of the NGOs in healthcare, they provided a asynchronous mode of consultations, where there were two modes of consultation in India by most of the NGOs. Like they set up vision center in rural community, whereby the patients will be coming to the vision centers. All the preliminary work, all investigations, all history taking, they're all auto-refracture reading, their IOP, their fundus reading, all will be taken by the vision technician. If he felt that his patient needed glasses, the technicians will prescribe glasses. And if the patient needed the medical consultation, the records were forwarded to the base hospital, and depending upon the priority or depending upon the urgency of the patients were connected by the base hospital or called or referred for further treatment to a tertiary center. This has been the mode, but there are two challenges in this mode. The biggest challenge is just that the patient is again exposed to a vision technician sitting in. So the part of the safety is compromised in this. Second is just that as per the telemedicine laws, every patient must be seen synchronously or asynchronously by the healthcare provider. Suggests that the vision technician should not be able to take a decision as per the law to see all the patients and decide which one to refer and which one not to refer. And this becomes a bit of controversy in the sense that many optical companies and many multinational companies are taking advantage of the same fact and using telemedicine to cover some of these flaws in the system. The second mode of asynchronous telemedicine consultations in eye care is happening by sending a mobile van to the patient's villages, whereby they have the two objectives. One is doing the refraction, and the second type of mobile van, sometimes it could be a bike also, sometimes it could be a full mobile van equipped with retinal camera. These are primarily used for detection of refractive error, providing glasses to the patients, or for detection of diabetic retinopathy. There's another area where such asynchronous mode is used is screening patient for ROP, whereby this is called vision on wheels, whereby a retinal camera is put in a small bag, whereby the vision technicians carry this instrument to the patients or to the children, newborn children, and does their ROP screening and sends the retinal images to the base hospital. So this is the basic mode of consultation or telemedicine which have been practiced. This mode of consultations required a lot of special connection in the past. They had a dedicated URL line. This was supported by ISRO, and it involved setting up a vision centers with all these devices. Sometimes they had instruments which was digitally controlled by the base hospital, and this setting up was expensive. What has changed now in last 1 year is just the shape. There are so many free teleconsultation platform that has emerged, and I would like to share, and I like to all of the optometrists and ophthalmologists to take advantage of this new development in our field, in the field of telemedicine. And I'll share you some of those platforms. And the first platform I would suggest you to see is DoxyMe, DoxyMe. I shared last time also. Any of you who wants to practice telemedicine right from the now onward, you can open their website. You can register yourself with your name or with the name of your hospital, with the name of your optometry clinic, and you will be given a dedicated line, and you will have a new address on your visiting card right from the beginning, right from the word go. And this service is provided free of cost. It's very popular in Australia and New Zealand, and it is free of charge but if you buy a paid version, it gives you certain more benefits in the sense that you can get EHR, you can get HIPAA compliances, and at the same time you can you can get notifications for the payments, etc. in this built in this platform. The second platform, which is freely available to all of you here, is a platform called Mind. This is called Medic Mind Tele Ophthalmology Platform. Medic Mind, MEDIC-MIND technology platform. And this platform is based almost on the same way. You go to this site and you can register. Advantage this platform offers is this, that you can upload your picture, whereby the patient can recognize you with your picture, and whenever they want to consult you, you can give them a time and the dedicated URL address, which is provided by this company, and you can connect to them. So there's another company which is providing this live simultaneous consultations, and this company is called iOS, which this is by, I'm sure most of the optometrists know this company. This is Advanced Ophthalmic AOS. It's Advanced Ophthalmic Solutions. It is by Keeler, whereby a patient can take the picture from his mobile phone of this anterior surface, and clinicians can send it to the clinicians, and the clinician can get a diagnosis of the dry eyes and the grading of the dry eyes sitting in a different location. So there are many platforms, most of them available free of cost. Some of them are paid versions, and the paid version is iCare Live, which has some advanced features in the sense that you can get your vision recorded there, you can get your contact lens supply from that, and you can get a payment gateway on those. So these new platforms gives every one of us an opportunity to explore telemedicine, teleoptometry, and teleophthalmology, and get ourselves introduced to our patients in a different manner. The way I'm consulting to you, thereby you can consult your patients one-to-one on a day-to-day practice of your eye care delivery. When I was talking to you about the models which are practiced in other countries of asynchronous mode, because our modes are basically have been limited to reaching to our telemedicine practice in India in past have been only to reach to the poor, to reach to the rural areas. That is what we understood by telemedicine in past. But during the pandemic, what has changed, how this asynchronous mode have changed is some of you who are in optical practices will understand that an optometrist is not, or ophthalmologist is not available in his clinic all the time. And when he's away, how the patients can get to reach that doctor. This is how the telemedicine have comes in. So there's a company in US called 20 by 20 now, whereby any patient can come to this clinic, which is enrolled by, which is having the equipment of 20 by 20. All patients at any time of the day are screened by an assistant, by vision technicians, and are connected to the optometrist, who may be sitting in another clinic, or maybe ophthalmologist who will be sitting in another hospital. And patients have liberty to choose whether they want to see the optometrist and ophthalmologist of the same clinic. At the same time, patients have a choice that they can connect to their own consultant too. So there are companies like 20 by 20 now. Is another company called Digital Optometrics. They have the same way of functioning, whereby all the equipments, all the data are shared with an optometrist or ophthalmologist who is in different locations. So as a result, you are able to increase your reach from one clinic to multiple clinics. If you are in a private practice, you are an optometrist or ophthalmologist, you want to extend your work to another area in a remote different locations, not necessarily a public health initiative, but maybe for your business purpose, you can start telemedicine in a new practice where it doesn't have so many patients coming in at the initial stage, and expand your business that way. There are companies like Topcon. I'm sure they are the manufacturer of optical or diagnostic equipments and optical instruments too. And they also have the telemedicine software, but their telemedicine software is only working with their own equipments only. Likewise, Zeiss also has their own instruments connected with their own software, and they provide telemedicine consultation to all the clinics who buy the equipment from them. So there are multiple ways the practice can be, started. You may choose any of those companies which are already existing. You may start only by providing consultation to patients who doesn't need to be screened in detail. And there are ways that comprehensive eye exam is started by a company which is called Globe Check, whereby 11 tests of any patient is done in a hospital, not in a hospital setting, but maybe a patient is visiting a mall, and this globe is installed in a mall, or maybe at the airport, maybe at the busy railway station, whereby any patient can get all the eye exam, including his vision check, including his autorefractometer reading, his OCT reading, his fundus reading, his outer surface examination, and his OCT. So all 7 tests are done within 13-14 minutes of time without any dilation. And all these data are sent to the Globe Check ophthalmologist, who will diagnose this patient, and he will refer this patient to the nearest ophthalmologist, optometrist impaneled with them. So we have a video with explaining, showing you how Globe Check works, and I'll be sharing this video towards the end. And this is how the technology is changing. But everyone's focus today is on refractive error. Everyone wants to get to do the refraction of glasses sitting remotely. And how it is being done in US, there are 4 companies successfully doing this in US without sending any device, without sending any instrument to the patient's home. And these 4 companies, which I'll be mentioning to you about, is one company is called Visibly, and this company was formerly called Optonative, and what it conveyed is alternative to optometry, which meant that they had objective that whenever a patient needs glasses, they should not be going to optometrist for the need for glasses or prescription. And they have a software which is approved by FDA for consultations for getting the prescription of glasses. So this company is again in US, Only thing is just that the patients who are below 18, above 50, or with any systemic disease, they are not allowed to be screened by this device. There's another company in US which is called 1800 Contacts. They are the largest online seller of contact lenses in US, and they have a eye exam which is called, which is again for, which is through a computer and through the mobile phone, whereby they can fine tune and get a prescription of their contact lenses and get a fresh supply, getting their eye exam on 1800 contact lens platform. And there is another company which is called Warby Parker. This is one of the largest retailers in US of optical frames, optical lenses, and they have an eye exam called Express Check. Again, patients can get their glasses prescription on this. And the last company which I want to talk to you, this is a company from Israel. This is called 6/6, and they have already a software which is called Lensometry, whereby a patient just download the applications, and with a small attachment on your mobile phone, you can get the prescription of your glasses at your home. And one of the largest retailer in India, which is called Lenskart, and they have invested $1 million in this company, and they are working to develop a software whereby they can prescribe, or they can send this through this software or through these applications, they can get prescription of glasses of anyone who is wanting to get online glasses from them or through their stores. So there's big race going on for refraction. Everybody wants to be a part of it, and everybody wants to find a very convenient solution for effective error. But what is happening is, we are talking about tele ophthalmology, and this has become a very great area of practice, because refraction covers about 80% of our patients' vision need, and everyone wants refraction of prescription of glasses in every patient. And if we cannot solve that problem, I think we may not be able to meet all the eye care needs successfully, because vision is the first, and that is where everyone's focus is. The third, I told you about synchronous mode of consultation. I told you about asynchronous mode of consultation on telemedicine. And the third mode of consultation, which is emerging in ophthalmology, is your remote patient monitoring. If you are following the news in India, most of our hospitals and most of our patients are advised to stay at home when they are not having so many serious complications. Patients are not encouraged to go to the hospitals, and encouraged to get the treatment remotely. And in ophthalmology, what all is happening is just that for measurement of IOP, there's a company in India which is called Eye Care, and they make a tonometer which is called Eye Care Home Tonometer, whereby just the way a patient can check his blood pressure, the patient can check his blood sugar. Similarly, a patient can measure his IOP sitting at home by buying that instrument or by renting the instrument. This model is very common in US, and in India, they are not renting it, but they are selling it to patients directly. And patients who have chronic glaucoma, they have the patients who need to be monitored for glaucoma. They are buying this equipment, and whenever there is an alert, that is sent to the ophthalmologist, and patients are monitored from distance. Likewise, we have, I'm sure for visual field, we have a device called MRF visual field charting, whereby patients sitting at home, their visual field can be measured on a desktop or on a laptop or on a TV screen, sitting by an optometrist sitting in his clinic. So these are the, these are the various models of remote patient monitoring that are emerging. One more for measuring, for checking the macular degeneration, whether the patient, if the patient is developing a wet AMD, there's an instrument called Free C Home, FREESEEHOME. This is an OCT which a patient can again measure his, check his retina on a day-to-day basis. And whenever the patient feels that he or she is developing wet AMD, it is reported to the ophthalmologist. So there are multiple instruments like that. There's another instrument which is used very extensively in pediatric clinics. This is developed by a company in Israel by the name called Vasant. And what exactly they do is just that this is a small digital device, small instrument, which is very compact and portable. Any child who is from 3 to 12 years of age, this child is asked to see a video or look at some pictures in this digital device, and this can measure 11 parameters, including the vision of the patient, vision of the child, his color vision, his contrast sensitivity, his convergence, his divergence, his binocular functions, it can measure the four isentropias. So 11 parameters of the patient are objectively measured by this instrument from called EyeShift, EYESHIFT. I would like all optometrists to Google this and see the instrument on your Google, on your computer, and know more about this. I wrote to them, I wanted to get this instrument, but at the present time, I got a reply from this company from Israel that they have given the sole rights of distribution to EssilorLuxottica for their worldwide distribution. So we will see what the pricing are and how the product has been developed. It has been given FDA approval, and it's an interesting development for pediatric practice. Then for binocular, patients having amblyopia, they're detected on eyesight, and the same company has developed a software for treating amblyopia, again using a hardware device whereby a child using red and green glasses looks at the interesting games, plays the videos, or watches the videos and plays some games, video games on this. And by reducing the vision of the one eye, which is good eye, this works and eliminates the need of patching in the children, and effective treatment for amblyopia is taken by the CureSight software. And there's one, I recently saw a publication from Eye Hospital in Gurgaon, whereby another software is developed, which is CureC, which is not so expensive, because the CureSight instrument is a hardware. It could be inexpensive, but CureC is a software device which can be installed in your own computer with a child's. It can be sent through a link to a child, and the child can look at the same way, the way I mentioned, look at this video and watch this, play some games on this, and find a treatment for amblyopia. So the interesting developments happening in ophthalmology and optometry. The word which is very common in India, which you have seen, taking the portable camera for ROP and for diabetic retinopathy, which has been in practice for quite some time, and I'm sure that many of you know in detail about that project. So in ophthalmology, starting from pressure, starting from visual field, starting from your all parameters of binocular functions, providing your glasses, providing your prescription of not prescription, but the treatment for your vision therapies. There's a software which is available to us from a good friend of mine, which is called Binocs, whereby you can give the exercises to a patient remotely for the convergence insufficiency. Whenever the patient has any problem with the binocular vision, there are certain exercises which you can do, and patients can improve sitting at home. Then what I want to mention about, I've told you about the synchronous mode of consultation, asynchronous, and I've told you about the remote patient monitoring developments that has emerged in last, not 1 year, but in last maybe few years, but have come into the practice of ophthalmology in last 1 year only. Then the interesting changes which have come in our hospital settings is, number one, use of your robotics. because of COVID, patients are to be kept away. The robots are being used in the reception of the hospitals. Robots are being used as a help desk to give diagnosis, to give the details of diseases. Their medical assistant robot, which can give the prognosis, which can suggest the treatment plan, which can suggest all the details of a disease to the patient. So the patient doesn't end up spending the chair time of the doctor, but he goes to this medical assistant robot and gets the full description, full details about this device. So robotics is coming up. I have a video which I will ask Kapil. Can you play the first two videos, and then I will take the rest of the presentations you have with you?
Sure, sir. Sir, is it from the Facebook or from the YouTube?
No, I've sent you the sequence of it. So first two on your WhatsApp. I sent you the three videos. If you can play the first two.
Okay. So let me know to choose it. Okay. Is this first one?
Yeah, you play it anyone. Doesn't matter. Just play all the three.
All right.
Doesn't matter. I think there's no audio here.
All right. So let me share it again.
Okay.
So maybe I have to share it again.
There are various types of robots which can operate in a hospital. For the patient, it is like talking to a doctor face to face. I am Rajiv.
Another video in which how the robots are helping patients to, just can you play this? How in one of the Fortis hospital, how a robot is being used.
Hi. Name please.
Sharat Kumar.
Phone number please.
9030-300-300.
Let me check your body temperature. Please take a step back and look into the camera. Your current body temperature is 100.8 degrees Fahrenheit. Do you have a fever, cough, throat pain or difficulty in breathing?
Yes, I'm feeling feverish.
The screening is complete. Now you will need to go to flu clinic for further assistance.
Hi Sharon. I see that you have fever with high temperature. Let me connect you to the doctor.
How are you today?
I'm feeling feverish, doctor.
Do you have any throat pain or breathlessness?
No, doctor.
It looks to be normal fever and not COVID. Mitri will issue the entry pass for you.
Thank you.
Please collect your pass and proceed through gate number 2.
And this is the third, And this is the third video which tells you about the future of Tele Ophthalmology and how Globe Check is going to
Welcome to GlobeCheck, the world's only comprehensive tele-ophthalmology solution. Our patented technology can complete an exam in less than 10 minutes without any dilation, touching of the eye, or eye drops of any kind. There are 11 tests that make up the testing package, and the quality of imaging is the same as the doctor's office. GlobeCheck is effective for virtually all ages and is handicap accessible. Patients can pre-register on any mobile device, tablet, computer, or at a kiosk, and are notified when it's time for their testing by text. Once the exam is complete, the patients may leave. All tests are sent through a protected network to our reading center where the tests are interpreted by a GlobeCheck certified doctor. A report is generated and sent to the patient. The patient then accesses their report through a HIPAA-compliant portal. They can then select their telemedicine video conference with the doctor to discuss their findings and recommendations. Our GlobeCheck mobile office can take the exam anywhere, eliminating access to care issues. Large and small businesses, schools, long-term care facilities, and community centers are just a few of the limitless locations where GlobeCheck can be deployed. GlobeCheck, the future of eye care is here now. Please contact us to schedule a demonstration.
Well, thank you, Kapil. And these are some of the latest technologies which are emerging in the world. And one more field which I want to share doesn't really concern with ophthalmology, but it's very relevant in present times, is remote ICU. Basically, this is to leverage healthcare providers. The doctor shortage is everywhere in every country, and whereby one doctor and 4 nurses can telemonitor ICU patients or ICU wards of different hospitals in different locations. And one doctor and 4 nurses are capable of monitoring 75 ICU beds sitting in the different locations. And this trend is getting very popular in US, whereby now they have 40 such ICU centers, and they are monitoring 3,850 ICU beds across the different states in the US. So the challenges and what we have to see is just that we need to adopt how we can implement telehealth in our practice. Any of you who wants to reach us, I will give you my WhatsApp number. You can send your name, you can send your message, and we can help you start telehealth right from the day one, right from the way go. My WhatsApp number, baby, you can send me the message is 98990 16027. I'll just repeat 98990 16027. And we can help you to connect with any ophthalmologist. I mean, not any, but some of the ophthalmologists are in our panel. And we can provide you teleconsultations to any of your patients in Nepal or anywhere in India, and put you on the board with tele ophthalmology or tele optometry practice right from tomorrow. So I'll be glad to answer if you have any questions on tele optometry and tele ophthalmology, and I'm here for your question answer session. Thank you so much.
Well, thank you so much, Dr. Ajeet, for such a wonderful session. And I guess this talk has for sure ignited a spark within us to start a teleconsultation practice. So, well, now it's time for the discussion session. So, we have our first question by Mr. Manish. So, am I audible?
Yes, I can hear you.
So, yeah, our question goes as this teleconsultation has came in our daily routine as in country like Nepal and India only after the pandemic. So, how much it will be applied on our society compared to the others? What do you think, Dr. Ajeet?
You see, it is correct that, what the progress, what tele-ophthalmology or telemedicine practice has seen in last 10 years has actually happened in last 1 year only. So the progress has been fast, but what I want to tell all optometrists is just that this is bound to stay. And in India, our government is very seriously pursuing it. If you know that during COVID times last year, Ministry of Health started a teleconsultation platform called eSanjeevani, and within less than 1 year, they have provided 30 lakhs teleconsultation through eSanjeevani platform. And now Ministry of Health has planned to connect all the community centers, all our primary health centers to telehealth. So this is going to be a way forward, not only during the pandemic, but leveraging our shortage of healthcare providers. It is going to be the, sorry, am I disconnected?
No, you are audible.
Yeah. So the telemedicine is going to stay, and I would encourage each and every optometrist. I have given my WhatsApp number. You can start wherever you are, and we can help you to, in whatever way we can.
So yeah, thank you so much, Doctor. So can you see the next question on our screen?
Will it as effective as the protocol followed earlier before this pandemic? You see, pandemic is just a catalyst. The teleconsultation is happening. Telemedicine practices were happening in past. Only thing is that we have seen an upsurge in them. So this is going to stay with. But let me ask you, like, I'm sure most of you have changed in the way you do your shopping. Most of you don't go to malls. Most of you don't go to high street to make your purchases and prefer to do online purchases. Most of you are buying your airline tickets online. And this is good. The same impact is going to be in the healthcare. Only thing is that healthcare was a bit late. It has come to the healthcare, and we need to embrace the technology and make sure that we use it in the best possible way we can.
So yeah, Doctor, we have another question. So let me check out the question. So next question goes as, how have telemedicine helped entrepreneurs flourish their entrepreneurship skills?
You see, the most important thing is this, that you need to be a good optometrist. You need to be a good ophthalmologist. What I mean is this, that good in the sense that you should have clinical skills to diagnose diseases. Telemedicine is just a way of practice. Is the only thing is that previously we used to see patients live in our clinic. Now we are seeing them through a virtual connection, through a digital media, and we need to learn that new protocols and new ways of delivery of healthcare. So nothing much has changed. The only thing is that we have to constantly keep on working on our clinical skills so that we are able to give better clinical decisions. We need to have good understanding of our diseases. We should be, if there is a doubt, we should call the patients in our clinic. And fortunately that we have, eye is such a sensitive portion that whenever there's an emergency, except in case of glaucoma, most of the time patients can come and tell us the acuteness or the severity of the problem. So we have to be watchful how we practice, but telemedicine is a media whereby we can reach to unreached population. We cannot travel all the time. Nepal is, again, you have quite bit of rural population whereby you can connect to your patient anywhere and give them all sorts of consultations sitting in your Kathmandu or Pokhran. So that's interesting.
So yeah, I hope that answered the question. Dr. Ajeet, we have our another question by Mr. Azaz. This question goes as, how challenging is tele-ophthalmology consultation as compared to the other fields?
You see, it's interesting in the sense that tele-ophthalmology, any field which can rely on imaging can adopt telemedicine, because in ophthalmology we can take pictures, and we have many instruments which can take good pictures. We have many indicators of the diseases which can be monitored using the pictures, whether it is the progress of glaucoma, whether it's the progress of a diabetic retinopathy. All of this can be seen on a retinal scan. And since the use of image has increased over the past few years, so ophthalmology is easy to practice in the sense that it's much easier than many other fields. So ophthalmology has good way of penetration in telemedicine. And many if you look at the portals, like every health platform, every telemedicine platform have at least 10 to 15 ophthalmologists practicing telemedicine. So I'm sure if they can do it, you can do it too.
Thank you so much, Dr. Ajeet. Well, now these are the only questions that we have received. So we will be waiting for some few more minutes if anyone is willing to ask. Kapil sir, do we have any questions left?
All right, maybe this is the last question. So we'll be waiting for a few more minutes. So if anybody have the question, kindly put on the comment section or chat box on the Zoom. So I can see this, a few of the people are joining the Zoom as well. So we have enabled our live system from the website. So you just simply can put the URL www.meroeye.com/live. So every time, whenever our YouTube channel as well. So these are the only few questions. And I also like to add, we had also started to provide the certificates. So I am just going to, maybe our IT sir drop the link of certificates, so you can get your certificates from the link. So these were the only questions so far. So maybe we have to wait for a few minutes and then.
And Kapil, I would like you to share my previous video with them, because if they look at the previous video and they can add these two together, they will have a good understanding of implementing telemedicine. Because that was the first one which I did, was the basic module, and this was a slightly advanced version of the previous one. So I would like that any of you who have not seen the video, you can see that video, and I'm sure it is on your website, and take advantage from that last lecture.
Yes, doctor, we definitely share this link. Doctor, if we see the telemedicine is somehow directly correlate with the AI, and if you want to, there is a very proportional directly connection with the telemedicine and AI. And I can see the, lots of companies who are, associated with the eye health, somehow they are trying to improve the AI. And, if you have to, relate this AI and the telehealth directly, so how would you like to, make more clear to our audience?
You see, it's a very good question, in the sense that AI is a technology, AI is a platform whereby you connect to your patients. And what artificial intelligence does is this, that it helps you in providing you a diagnosis of any disease. I mean, like suppose let's start with the first the AI platform which was approved by, not AI platform, but AI app which was approved by FDA for diabetic retinopathy screening and grading. And this app again I'm proud that it is again from ophthalmology, which is called, the app is called IDXDR. So under the app, you just take a picture of retina and you send it to the app. And this app is able to diagnose whether the patient needs referral or not. And these applications of diabetic retinopathy is gaining so much of importance that the patients are not seen by any retina specialist. So the app can enhance the technology. It can improve your efficiency, your accuracy, your precision in making decisions, and not make human error mistakes. What we normally, if you send one retinal image to 10 ophthalmologists, and asked about the grading, you will find that the grading report will be coming differently from many of them. While if you put the same reports in AI, the reports will be consistent. So AI is a medium whereby you can enhance your decision making faster, quicker, and with more accuracy. And it's not only happening in diabetic retinopathy, as I mentioned about screening, about if you look at they are AI, they are artificial intelligence applications for your dry eyes. As I mentioned about, there is one program which I mentioned about advanced ophthalmic solution by Keeler. So this is you have the optometrists need to understand how the AI works. AI is just a way of artificial intelligence, whereby you can take different pictures and of the eye, start feeding them into the computer, giving them a proper diagnosis, and later on the computer starts to learn whether this particular disease is there or not there. And I'm sure that when time to come, many optometrists will come and specialize in artificial intelligence too, because there's much and much more scope of optometry developing AI applications in their field. So starting from refractive error indications, starting from glaucoma, starting from diabetic retinopathy, uveitis, every disease can be diagnosed by using artificial intelligence, and they have to be done locally with the hospitals which have more data. They are more powerful in developing the artificial intelligence, and I'm sure that we will see more application in the near future.
Yes, true, doctor. I completely with you, Tom. There are lots of expect to be infected from the doctors to the patient as well, and we can efficiently reduce the human effort, and we can provide the better care, especially like in India and Nepal, where we have to large number of patients. By considering this thing, if we look the side, if the people are present or doctor present with you for the examining the anything, or presenting by the virtual medium, it's somehow only I can see the people's only visiting the doctors. We used to talk about the placebo effect. I mean, how they can recover only by seeing the doctors, only by touching the doctors. Even some of the people, some of the doctors feel only by tossing the doctors to the patients give certain type of relief, and they feel like they get well very soon. So we didn't have this type of directly contact with the doctors. So how would you like to consider this situation?
Well, I think with technology, everything is changing, and I really feel that you can be as empathetic and as as effective in a virtual teleconsultation as you can be in a live consultations. I know that we put more effort with our patients when we are face to face, but at the same time, if you look at the delivery of, like, suppose we had not seen this pandemic, when maybe you wanted to hear my talk, you would have invited me and to your country, you would have arranged a conference room and then maybe held a talk, which could be very, very expensive way of dealing it. But I don't see that. If you look at the output of it, it is much different. Yes, I'm not able to see my audience, each and every one of you face to face or with eye contact, but at the same time, I believe that you can be equally effective using the virtual medium, and it is just question of time that people will get used to it and start to learn, start to embrace and take effectiveness from the virtual consultations, and people are already doing it. If they were not getting treated with this, they will not be consulting their doctors, and we have to look at the convenience factor as well. It would have been difficult for me to go travel to different locations to deliver a talk, but now I can do it at my convenience, and we have to see the positive side. And same thing for patients. How many times the patients would like to come for a treatment to the hospitals? Like, suppose I'm sick and I want to see a physician, and if I get a physician on virtual consultations, I would like to have that rather than going and standing in his hospital or waiting in the line, because of the chances of infection are increased by visiting to doctors. So all those factors, if you consider, there's an increase, and we need to feel that sense and try to adopt the technology.
Yes, true, doctor. So these were the only question maybe we have till now. So if anybody have the question, we will be considering by the Gmail. Before that, I guess we have some announcement for here. Maybe for the next talk. Solu, can you please continue your words?
Yeah, well, thank you so much, Dr. Ajeet, for this wonderful session. So I request you all to get your certificate from the attendance link, which is dropped on our YouTube chat box. And at the same time, I also want to do a short announcement that we will be having again another session by Dr. Ajeet on setupping and teleconsultation. So we will be having it shortly within few days. So I request you all to attend that session too. So I guess that's all for today. So before I wrap up, I request Dr. Ajeet to share his few words to our program.
So I'm sorry, did I miss you? Or thank you very much, and it will be my pleasure to be here again. Thanks a lot.
Thank you so much, Dr. Ajeet. It's our immense pleasure to have you with us today, and we would love to see you again after a few days.
Thank you. Bye.
So herewith, I announce the closure of today's webinar. Hoping to see you all again soon. Stay safe, stay connected. Thank you.